conversation is still on ulcer. Now we're moving it a bit higher because we have a guest right here on tea or coffee. She is a very familiar face with us. We have Tosin Olowo. Good morning.
Morning.
How are you doing?
I'm okay. I'm good.
All right. Now, before we went on that break, we were talking about some myths and some facts about ulcer. And the very popular one is when you don't eat, you get ulcer. Or when you stress, you get ulcer. So how true are these things?
Well, the major causes of ulcer are not really because you don't eat or because you're stressed.
Okay.
But it can also be a factor. For example, the normal process of digestion involves the stomach producing acids, some gastric acids for digestion of your food.
Yeah.
So when you don't eat throughout the day, there's already production. Mm-hmm. So when that keeps going on, you tend to produce, the stomach tends to produce more of this acid. And by doing that consistently, you tend to affect the integrity of the mucosal lining of the stomach. So yes, so really we can't say that that's because there are other factors, but yes, it can also predispose you to that. And then there's something they call stress ulcer. Well, from research, we've not really been able to say, oh, stress causes ulcer. Okay. But like I said, it can also be a factor. There are some physiological factors, because when you're stressed, you tend not to eat, or you're just not in that right state. So there is excessive production of this acid, and you can have that symptoms, but not as severe as when you have peptic ulcer.
Okay, so what exactly is peptic ulcer? Because now you've mentioned something on stress ulcer, and I'm guessing there are, other types of ulcer. So what exactly is peptic ulcer?
Okay, so peptic ulcer is a sore in the lining of the inner layer or the mucosal lining of the stomach, or the duodenum, because really ulcer does not only affect the stomach, it also affects the duodenum, which is part of the small intestine.
Right.
So it's the sore, like a wound, sort of, because when there is break in the integrity of the mucosal lining, it tends to develop wound, which is what I refer to as sore. So it affects the mucosal lining of the stomach and that of the duodenum.
So I'm guessing the mucosal lining is in the stomach.
Yes, it's in the stomach. Yes, in the stomach.
So what exactly causes it? Because I mean, I've been looking at different things. We've taken some meds, and then they say, okay, stress may not be a cause. You not eating or eating, because I mean that's what everybody says. You are not eating, you will have ulcer. You've not this one, you would have ulcer. So what exactly is the cause?
Okay, there are two major causes of ulcer. One is infection of a bacteria or bacterium called Helicobacter pylori. It's a bacterial infection, and which is usually gotten through contaminated food and water. While the second cause is prolonged use of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, and we use it every day because you have menstrual pain, you have
like painkillers,
ibuprofen, diclofenac, aspirin. So that these drugs that we tend to use over time, and sometimes there are protocols. They might say, okay, don't use this drug without eating, but use this drug with eating. I'm sorry about that. Use this drug after eating. But most times, because of the pain, you don't even want to eat because of the intense of the pain. You use it, and when you continue that way, it stimulates over secretion of this acid, which affects the integrity of the mucosal lining of your stomach and the duodenum. So, I mean,
when they actually say eat, then use your drugs, it's a big deal.
Yes, it's a big deal. It has impact. So because this NSAID, for example, it blocks prostaglandins. So prostaglandins are usually they're on the lining of that mucosa layer, and they're supposed to help they're supposed to neutralize the acid secretion of those gastric acid. So now when you now take non-steroidal drugs, they take off those enzymes. So now there is nothing to help you. It's not stimulates overproduction of the acid that causes So now it's not like when you use it once, it just happens, but
So
prolonged, a continual use. Yeah, so if you have to use that drug, if there's no history, your doctor would have to tell you, oh, you can use it with some proton inhibitor. There are ways by which you can use it. So yeah.
Okay. So majorly, when they ask you to eat before you use your drugs, it means that you really have to eat before you use your drugs, because day in, day out, if you keep doing that, it accumulates and then becomes a problem for you. Now, so what are the symptoms? How do I know that I have ulcer? Because I mean, the most popular saying from anybody is, oh, my stomach is peppering me and all of those things. But what are the symptoms? Does my face swell up? Apart from the pains that I feel in my stomach, does my legs swell up? What exactly would I see?
Okay, first off, I would like to say that not everyone that has ulcer has symptoms. Some might even have ulcer and they don't have symptoms manifesting yet.
How?
Yes, they don't have symptoms. While, okay, now back to symptoms. Some have abdominal pain. That's the basic. That's the one thing that we know: abdominal pain. And the pain is usually from your navel. It could be between your navel and your upper abdominal region. We call it epigastric pain, just here. Okay. So the pain could be here. Most of the time, the pain is here, but it could still extend down to your navel region. That's around your umbilicus down. Yeah, and then there is bloating. You just hear, I just feel bloated. Some belch. I'm passing so much gas. There is and then I forgot to say, for the abdominal pain, you could say, I feel this dull pain, I feel this burning sensation. And the burning sensation I like to explain is, you know, for example, you have an ulcer, open wound, and then you pour pepper. You can imagine. So that is the proper description of that burning sensation that you have. And then I said bloating, belching. There could be loss of appetite. Okay. Sometimes they don't want to eat because they feel full already. It's just part of the symptoms. You just feel full. You have loss of appetite. Then in some very critical cases, there's vomiting. All right. Yes. Then there's loss of weight. Yes. Interesting. Yes, loss of weight.
I mean, at some point you can feel bloated, and then there's also loss of weight in all of this.
Yes, wow. Because you're not eating. Remember, you feel bloated, you just feel full. You're not eating. There's loss of appetite. Yes.
So I mean, in the myth that we took earlier, we said something about milk, and milk may be a cure for it. How true is that?
That is not scientifically proven.
All right.
So rather I would rather prefer antacids to milk. Yes, milk has been found to have this neutralizing effect for the over-secretion of the acid, but it's just very short, because it can also still stimulate, as it has the neutralizing effect, it can also still stimulate this acid production. So for me, I'll say no. Yes.
All right. So now, if you have peptic ulcer and you don't know that you have it, because I mean, you already said that it isn't all ulcers that actually showcase symptoms. How would you know? What do you do?
Well, you can just, there's this, you know, usually we're expected to do this medical examination at least yearly. If you can't do every 6 months, at least for people under the age of 40, at least just try and do it yearly, or maybe 2 years. Yes, so when you do, it's part of those basic tests that you do. H. pylori test. Okay. That's for H. pylori test now, to test for the infection. So it tells you whether the bacteria is positive or negative. Okay. But even with having ulcer and you don't have symptoms, if you don't have symptoms, then there might not be need, actually. But I would employ for the basic checks yearly, because it's good that you detect these things earlier, which helps you to manage it more better, so that it doesn't lead to a more chronic disease. You know, we have chronic peptic ulcer. So that it doesn't get to that point. Okay. So yes, so basic medical checks. That's fine, at least yearly.
You know, earlier we were saying different sorts of ulcers. I'd like you to mention it because the popular one is the stomach ulcer.
Sorry,
The
can
one
I
you,
take my...
yeah, sure. The one that you feel in the stomach, the pains that you feel in the stomach, and all of that. But then I know for a fact that we have other ones that might not be stomach inclined.
Okay.
Can you mention
Okay,
that?
yes, we have different types of ulcer. So I will categorize esophagus, stomach, and duodenal ulcer as peptic ulcer.
All right.
We also have mouth ulcer. We have arterial ulcer.
What is that?
When like an artery is impaired, usually it's not like it's the artery that has the ulcer. Now it shows on the outside, maybe on the skin.
Okay.
Yes. Then there's venous ulcer. That one is very, very common. When you see, say, some leg ulcers, because there's no blood flow to some particular place, so the nerve there dies. There's no blood supply to that part of the body, and then you see the ulcer manifest outside like a big wound. Most of the time, if it gets really bad, that it affects the nerves and everything, they might have to amputate that part of the leg. So
wow.
Yes, venous ulcer, mouth ulcer, arterial ulcer, peptic ulcer.
Wow.
Yes, but the most common is a peptic ulcer because, you know.
Because that's what everybody talks about.
Yes, and it's very common.
Just a quick conversation on the mouth ulcer. How does that happen?
Well, there are so many conditions that can predispose you to that.
Okay.
For example, some viral infections, some bacterial infections can also cause that. So that is that.
Okay. Because in my mind, I would have assumed that maybe it is food that you eat, and maybe probably some infections whatsoever.
Yeah, there could be infections. So that's what I said, like viral infections, bacterial infections. So they could manifest on the mouth, causing mouth ulcer. Yeah.
Does carbonated drink have anything to do with ulcer? Because I also hear that a lot.
Yes, because like I said, carbonated drink does not cause ulcer.
Okay.
But because there is an existing ulcer, it could aggravate the pain because this also stimulates more production of acid. Ah. Yes. Right. So if you know that you have ulcer, just stay clear of that because it will worsen the condition.
Let's talk about treatments. Now, if you know that you have peptic ulcer or any sort of ulcer, what should you do?
Okay, first of all, for me, I used to say there are 3 goals to managing ulcer. First one is to relieve pain because, you know, ulcer is very, very painful for those that have it. Those that have had the experience will tell you it's very discomforting. So first of all, the goal of management is to relieve pain, to heal the ulcer. And I know there are so many times they say ulcer can't be cured. That's a lie.
Interesting.
Yeah. So, and the third one is to prevent complications. Okay. Because by the time there is complications, at that time we're talking of chronic peptic ulcer disease. Oh. Yes. So now, talking of relieving the pain. So for someone that has been identified that they've been on prolonged use of non-steroidal anti-inflammatory drugs, such as the ibuprofen, aspirin, naproxen, diclofenac, they have to stop it. All right. Yes, they have to stop it immediately or reduce it, depending on the doctor's management. But most of the time, they discontinue and just place on other analgesics that are not NSAIDs. And secondly, after they've done the test and they've realized that, oh, the person is positive for H. pylori, there is a treatment, and that's antibiotic. So there's something we call triple therapy. All right. I'm not going to go into details. Okay. But it's triple therapy. So this triple therapy involves 3 drugs, 2 antibiotics, and 1 proton pump inhibitor, which also helps to suppress the production of acid. So they work hand in hand. So with using that treatment in H. pylori infection, ulcer can be cured. Yes. Okay. Yeah. So that's just basically the both. Then sometimes we use antacids too. Antacids are just short term. You know, they prescribe antacid, use Gestid 15 ml, 8 hours, you know, 3 times in a day. But when you are using the proton pump inhibitor that I talked about, it's just once in a day. So it takes you, it has the outline that takes you throughout that day before your next dose. Unlike antacid, antacid is short. When you use it this morning, you have to use it again in the afternoon, especially for those that have prolonged pains. So you have to keep using at least 3 times. Sometimes I've had a patient that you've prescribed, and yes, but because you're not there, they start to use it because they're still having the pain. Yes, so it's short-term agents, a short-term drug. And then we have H2 histamine. H2 antagonists. Yes, it blocks. So the histamine receptor. There is an histamine receptor antagonist. Yes, I know it's a medical term.
Yes,
so you might not really understand.
I'm waiting for the explanation.
Yeah, so like this cimetidine, it also helps to reduce the production of acid. But I would still prefer proton pump inhibitor, depending on the clinical judgment of the same consultant or physician. Yeah,
I like that you said, you know, that last part, depending on the clinical judgment of the same physician, because, you know, another thing that is very major is the fact that some people self-medicate.
Yes. So all this medication, all these treatments, once you've seen that, oh, yes, you feel it is ulcer. I hope I'm not jumping.
No.
Okay, so once you notice that I feel these symptoms, I feel this dull or sharp or burning pain in my chest or in my epigastric, because chest, most people will say, oh, in my chest, it's just up here. It's so tender, I feel so much pain. When you feel that kind of pain and it's been persistent for so long, I'd advise that you go to the hospital or a clinic. Just let them assess you and make a diagnosis. So they'll send you for some investigations. They can send you for the H. pylori test or endoscopy. So endoscopy is another detailed investigation that is done. It's invasive. So they just check what's going on in your digestive system.
All right.
Because all this we've been saying is just about the digestive system, from the mouth to the esophagus to the stomach to the small intestine, which affects the duodenum, which is the first part of the small intestine. So when they diagnose, they see what's going on there, they try to pick out the ulcer, and from there they would give you they will let you know which type, the cause of the ulcer, and then which would determine your treatment.
Okay. Yes. Now, before we let you go this morning, because I mean, I've learned a whole lot from this conversation that we've had, and what not to do if you know, you have peptic ulcer. Now, I'd like you to advise people on not self-medicating and actually, you know, doing the needful. And also, I realized that lifestyle choices can also be something. So please advise.
Okay. First off, in Nigeria, you know, is one thing that we are used to, because in my environment, this is where I am, so this is where I can speak of. You know, we are so used to taking care of ourselves. And most of the time, so many things can be averted when you seek proper care early. So I would say in this case, when you feel an unusual pain or you feel an unusual discomfort that you really can't say, don't just go to the counter to get a medicine, because really no one knows what is going down there. Do you know that sometimes gastric cancer also almost have some symptoms, as especially when the gastric ulcer is in the chronic stage, it has some symptoms as gastric cancer.
Wow.
Bleeding, we call something melena. You start to stool, black stool, because there is bleeding. So, but because the blood has been digested, so it's black stool. You throw up and it's black. It's called occult, like you bleed, it's dark. Sometimes it can be red. We call that hematemesis. So when you notice, if you feel that, let me just go to it looks like a symptom one of my friend has and it's ulcer, let me just go to the pharmacy to get a drug. You might just treat what is wrong, and then the disease condition begins to progress, which by the time you get the proper treatment, it's already late. So when you see a symptom that you feel that this is something I'm not familiar with, or even if you're familiar with it, just go to the hospital, seek proper consult, let them examine you and be sure of the source or the cause of whatever is happening at that time. so that they prescribe the correct drug for you, and then it can be treated early. Because we didn't talk about complications. When you don't talk, when you don't treat this early, it could lead to bleeding.
Okay.
You start to bleed inside, not outside. Now you can't see.
Internal bleeding.
Yes, there's internal bleeding, GI bleeding. It's called GI bleeding, gastrointestinal bleeding. So you start to bleed. There could be perforation. So there's perforation of your stomach or your duodenum outside to the abdominal wall, inside. So there's perforation. That's the only thing that could resolve that is by doing a surgery. Yes, and there could be gastric outlet obstruction. Your food is just there in the stomach. It's not
going anywhere.
It's not going. It can't go because there's some sort of obstruction.
All right.
So it's better that you seek healthcare counsel fast and early, so that you can be treated appropriately and to delay bad prognosis.
Tosi, thank you so much, because now I see the essence of, seeing a medical doctor, especially when you start to experience pain in your stomach area and even in your mouth or wherever it is. You have to actually first go see somebody that would give a diagnosis, and then you know what to do from there. We just had a conversation on peptic ulcer with Tosi Olowo. She is a medical practitioner, and we have learned this morning that it could go bad if you do not see a professional.